Hello, my name is Kaylee Gallius. I am doing a presentation for my bioethics class. In this presentation, I will be explaining how transplant teams decide who gets an organ. Organ transplantation refers to removing organs from a donor and transplanting them to another person who is very sick or dying due to organ failure. Transplant teams and medical professionals consider various ethical and legal factors in deciding who gets an organ. These bioethical factors include compatibility and availability, legal factors and informed consent, and ethical nursing principles and health equity. The goal of organ transplantation is to save the life of someone or increase their chances of survival. Organ transplant medical teams consider various ethical principles, legal framework, and practice guidelines to determine transplant candidates that get an organ. For example, the Uniform Anatomical Gift Act of 1968 states that donated organs are anatomical gifts that should not be sold, whether by living or dead donors. Ethical factors include analyzing compatibility to prevent potential infections or death resulting from the organ transplant and informed consent of the recipient, donors, or their families. Another equally important factor is health equity, which ensures everyone has equal access to the available organ. Compatibility and availability. Compatibility refers to organ matching like blood types, antibodies, and the size of the organ. All organ transplant candidates on the waiting list are examined in terms of compatibility to promote safety and quality. Availability refers to the available and ready organs as well as the geographical location of the hospital, recipient, and donor. Geographical factors also promote efficiency and increase the recipient's chances of survival. Organ transplant teams analyze the compatibility of the organ donor and the recipient's antibodies, blood type, height, weight, and other medical factors. For example, in kidney transplants, medical professions must examine whether the organ donor and recipient's blood type and antibodies are histocompatible. Compatibility during the donor-patient pairing helps medical professionals improve the quality of the organs, reduce disease transmission, and maximize the efficiency of the donation of the body organs and transplantation. On the other hand, availability factors comprise the logistical factors, quantity of organs, health safety elements, and affordability. In availability, factors of compatibility, preservation, and transport time, and the size of the organ come into play. Legal factors, the principle of nursing, and health equity. Various legal frameworks promote organ donation while eliminating the risks and controversies resulting in organ transplant decisions. For example, the organ transplant teams use medical and logistical factors only in organ matching and transplant decisions. Factors of health, equality, and organ transplant are equal access to the availability and affordable organs. Efficiency and efficacy promote the health and safety of the recipient. Ethical principles of healthcare include informed consent based on the patient's age, personal moral values, and religious beliefs. Organ transplant teams promote equal access to available organs and integrate the best interests of the recipients and their families based on existing legal frameworks and ethical principles, such as informed consent. Personal and socioeconomic characteristics of the recipients, like income or celebrity status, are not priorities of organ matching and transplant decision. Also, the sale of human organs, whether dead or alive, is prohibited under the law. The principle of health equity promotes the availability, efficacy, and affordability of vital body organs, while maximizing the safety of all recipients, regardless of their personal, social, economic, or political characteristics. Factors affecting health equity and the equitable access to healthy care services in organ transplantations include the ethical principles of nursing, geographical factors, and medical factors. Healthcare professionals must make better decisions to handle the donated organs and analyze the possibilities of emerging infections from the transplant. Other factors of health equity are the donors' and recipients' best interests, which include personal beliefs, cultural moral values, and religious beliefs. Factors in organ allocation. Different types of organs, such as kidneys, lungs, liver, and heart, have unique characteristics. Organ transplant teams use unique distribution policies for each of these organs. For example, in kidney transplantation, medical professionals consider the waiting time, compatibility of the blood types, and other medical factors. Nonetheless, for all vital organs, transplant teams must consider the following: the donor's health condition, the right size of the organ, geographical factors, and recipient related factors. Vital organs such as kidneys, lungs, liver, and heart must be analyzed regarding donor-recipient compatibility. At the same time, each of these organs have unique characteristics that lead to different health conditions, experiences, and patient outcomes. Conversely, in addition to analyzing the medical and compatibility factors, each organ has its own distribution policy reflecting its unique type and characteristics. For example, the unique characteristics of kidney allocation and transplantation include the allocation of waiting time, compatibility of the blood types, and other medical factors. However, transplant teams use some similar principles or methods to decide who gets an organ. The common factors in all processes include the donor's health condition, geographical factors, organ donor patient compatibility, the right size of the organ, and the recipient's related factors. Geographical factors include the distance from the hospital and safe storage or preservation, while recipient-related factors considered are the recipient's chances of survival and pediatric status. Organ transplant teams use a unique scoring system for pediatric candidates, where children are given the first priority when child-sized organs are available. William Moon is just one of our many local heroes. Just 8 days ago, firefighter William Moon from Islip was laid to rest, and even in death, William Moon will be remembered as a hero. With his organ donation, he was able to save 5 lives. I will now play a clip from December 20th from News 12.
A fallen FDNY firefighter continues to be a hero tonight. Live on New York now confirms that Islip native William Moon has saved 5 lives through an organ donation. So that includes 3 patients in New York who were in need of heart, liver, lungs, and kidneys. And as we've reported, the 21-year Department veteran was killed after falling in a training accident at his Brooklyn firehouse last week.
His death is a tragedy, but it is bittersweet to know that he is giving life to others. I hope this information was helpful to you and that maybe you're considering becoming a donor yourself. Thank you for listening to this presentation. I hope you enjoyed it.